At every opportunity, the Jewish community has taken responsibility to support health and well-being. Like people of every ethnic background, Jews are faced with specific genetic concerns. In the 1970s, a team from Yeshiva University's Albert Einstein College of Medicine launched Operation Gene Screen. They rode in a van from neighborhood to neighborhood, screening thousands of Ashkenazi Jews to see if they were carriers for Tay-Sachs disease. It is widely considered to be one of the most successful public health initiatives in medical history.
I think the basis of the screening was really what our little booklet said. Knowledge is power. Knowledge is protection. And that's why I think it's been so fabulous that there's so many genetic diseases that we can identify now that carry a state and help couples protect themselves against tragedy.
Thanks to the continued vigilance of the Jewish community, today it is rare for a Jewish baby to be born with Tay-Sachs disease. But with the recent explosion of genetic knowledge and technology, there are now many other Jewish genetic health issues that require the same focus and attention. Not only diseases like Tay-Sachs that can affect offspring, but also diseases such as cancers and adult-onset brain disorders. We also need to think beyond diagnosis and prevention and explore treatments and cures, including bone marrow transplantations and novel gene therapies. The Program for Jewish Genetic Health of Yeshiva University was established to ensure the well-being of families today and to provide a lasting gift of health to the future. Our vision is that nobody in the Jewish community should face a genetic health issue due to lack of awareness, financial barriers, or difficulty in navigating the healthcare system. We are a joint program between YU and Einstein, one of the first of its kind. Being a part of YU's Center for the Jewish Future helps us reach the global Jewish community. And having program directors who actually practice clinical medicine and laboratory genetics at Einstein lets us provide the community with much needed healthcare services and genetic education. While formalizing our relationship with YU and Einstein was a high point of 2011, the program had already been working towards its goals. Since 2006, we have been providing young Jewish singles and couples with accessible and affordable carrier testing for Tay-Sachs disease and a host of other Ashkenazi Jewish genetic diseases that could affect offspring. By partnering with other national screening programs, and thanks to very generous donors and genetic testing labs that provide philanthropic rates, we have already tested more than 4,500 individuals.
Genetic testing can be very expensive, and this program provides a great service for young couples in the Jewish community. The peace of mind it gave us is truly priceless.
Well, with such a small gene pool, there's a lot of diseases out there, and it's good to know that you can kind of know what you're getting yourself into. If there's any concerns beforehand, you know, finding out you're pregnant and then finding out that your child has some sort of disease is a really scary thing, and to have someone to help you through that, or someone to help you even screen before the process so that never happens to you, is just, like you said, priceless.
Platelet Tay-Sachs carrier test that was developed by our laboratory directors in the 1970s remains the gold standard test. It is in great demand from our screening partners and from doctors nationwide. Its effectiveness in identifying Tay-Sachs carriers also is allowing us to expand testing beyond the Jewish population. Knowledge is power. The Program for Jewish Genetic Health offers educational programs to various sectors of the community to boost awareness and knowledge and to empower individuals to become active participants in ensuring their own well-being.
It's really important for the Jewish community of all streams to learn about Jewish genetic diseases, to be counseled and to understand their impact and most importantly, to test and to prevent. This is an area that we can band together and do this work. It's about the Jewish community, and it's about the future, and it's about health. We can do this together.
We also work closely with Yeshiva University's Center for the Jewish Future to educate the rabbinical and lay leadership on genetic health issues and provide suggestions on how to provide pastoral care and referrals to those who are facing certain health situations.
Now, with the help of this new initiative, we have the opportunity to now focus on issues of genetics and to have experts to give our students guidance of how they should conduct their lives, how they can deal with issues of genetic challenges, as well as how our students can become leaders in this area.
By working closely with young students, we are infusing the next generation of Jews with a spirit of leadership and a sense of responsibility to the Jewish people and to society in general. While we are proud of previous accomplishments, there are now so many more challenges for us to take on and overcome. We aim to be the centralized resource that the Jewish community can turn to for all Jewish genetic health concerns, from before birth through old age. Aside from the ongoing carrier testing, imagine if we could prevent breast and ovarian cancers, complete the bone marrow registry to cure leukemias, or understand the genetic impact of adult disorders such as Parkinson's disease.
But now, of course, we have the ability to sequence whole genomes of individuals. We may, for instance, identify new conditions that we should be screening for that we don't screen for already. But quite frankly, that just represents the starting point.
Our motto, working together to protect the chain. The Program for Jewish Genetic Health is all about community and partnership. We are here to service the community and listen to its needs. By combining the power of YU and Einstein, and by partnering with many outstanding organizations already working so hard on this throughout our country and beyond, we are all well positioned to triumph. Supporting life and ensuring quality of life are fundamental tenets of Judaism. The more rapidly we can meet the genetic health needs of our community, the more lives we can save, and the more needless suffering we can avert. Join the effort. Together we can do this.